Welcome to the MM Endometriosis Podcast, your space for honest conversations, expert insights, and real stories from the endo community. We're finally here and we're so glad you're joining us. This podcast is brought to you in proud partnership with Period Harmony, your go-to drug-free pain relief, now available at Boots UK, because pain should not be your normal. In today's episode, we're diving into a crucial topic, endometriosis and fertility. I'm joined by Dr. Jessica Miller, a naprotechnology trained surgeon who's changing the way we approach fertility. Could you tell us a little bit about your background?
Yeah, so I'm really excited to be here. Thanks for inviting me on the podcast.
Thank you.
You said my name is Dr. Jessica Miller. I am a board certified OBGYN. I worked for a couple of years as a generalist, and then in that process, I really realized that there is such a gap in care for women, in particular for endometriosis care, for infertility care, for women who are really looking for a more holistic approach, a more root cause approach. And so at that point, I then went back and got a little bit of extra training. I practiced something more specifically called naprotechnology. And with that, I now am looking to focus my work on infertility and endometriosis care more specifically.
Excellent. And what is naprotechnology?
Naprotechnology is a way of approaching women's healthcare that really looks at the root cause. So something that we really emphasize is looking at endometriosis and actually excising that, using surgical techniques to do that so it's excised appropriately in its entirety, repaired so that we prevent pelvic adhesions. But then also this form of women's healthcare looks at the hormonal imbalances that may be going on. So we are really looking to find the cause of the issues that are going on.
Yeah, because it's not spoken about a lot. We know the hormonal imbalances are there, and I've heard a lot about estrogen, but I don't know specifically with the disease that I've had for decades. I don't know really how it works hormone-wise. So I wanted to talk to you a bit about your expertise in fertility in terms of women with endometriosis. So for anyone that's not sure, how does endometriosis impact fertility?
Yeah, unfortunately, I think there's a lot of misinformation about this. I think women think even with endometriosis, they can just kind of bypass things and use IVF, but it will even affect your IVF rates as well. So endometriosis has a significant impact on fertility and is really something that affects quality of life as well for a lot of women and needs to be addressed as soon as possible because of both of those aspects.
So that actually brings me on to the next question, which was about, can delayed diagnosis with endo have an impact on women's fertility?
Yeah, in women's healthcare, there's a lot of data missing. So we can't say for sure that if we wait X number of years, this has a significant impact. But what we see as clinicians really makes us think that that's the case. When we have a pelvis with endometriosis, our inclination is that what we're really seeing is that typically that continues to develop more endometriosis, more adhesions, more problems.
Yeah.
So if we can catch that earlier, operate on it, remove it in its entirety by a trained surgeon who specializes in that, it should have better outcomes in the future. By the time we get down the road and things are really, really bad, sometimes it's almost impossible to repair things in a way that still preserves for your fertility.
It's so sad to hear, because I think that's the case a lot of the time. And when I was diagnosed with stage 4, I was only 23. And before the laparoscopy, they had said if I had endo, it would be stage 1, minimal. And that wasn't the case at all. And my fertility needed to be preserved at that young age. So, yes, I mean, I dread to think if I had waited. Dread to think.
Yeah, and unfortunately, a lot of teenage, adolescent girls will present with symptoms of endometriosis, and some physicians will tell them that they're too young to have endometriosis, and that is just not the case. So it does not matter how young you are. This really is something that should be addressed regardless of your age.
Yeah, absolutely. Thank you for that. So what steps should somebody take if they suspect they might have endometriosis but they don't have a diagnosis?
Yeah, so things that would make me concerned, kind of to back up, why would someone be concerned? So some things that would make sense that they have endometriosis would be pelvic pain. That can either be with your cycle or outside of your cycle. And in particular, pelvic pain that's affecting your quality of life, your ability to go to work, to go to school. So that's a huge red flag. Also with that, abnormal bleeding patterns. So we often have those women chart their cycles because there are bleeding patterns that can be associated with endometriosis too. But the other side of that is some women may have silent endometriosis, and the only way we know that there's an issue is because they're experiencing infertility. So if any of those things are something that resonates with you, that would be a concern for endometriosis. In terms of the next step, it's really about finding someone who specializes in this, because unfortunately, so many women have experienced care for endometriosis that really isn't appropriate. So, for example, not removing it in its entirety, or not doing the steps necessary to preserve fertility to prevent adhesion. So, you only get one set of reproductive organs. And so it is so important and vital to protect those, because you get one shot and that's it. Unfortunately, we see when patients go to someone who's not specialized in this, they might remove their tubes or tell them they just need to do IVF, or not really address the root cause. So I think the number one thing is finding a physician who specializes in this and who you trust to do a good job.
That's excellent. Thank you for that. So what fertility treatments are commonly used for patients with endometriosis who are trying to conceive?
Yeah, so the number one thing is surgical excision. That drastically improves fertility rates, and often is the number one thing that they really need to get pregnant then naturally. So the work that I specialize in really focuses on natural conception, on restoring hormone health, restoring reproductive health, to allow the body to do what it's meant to do. With that, endometriosis needs to be excised. And on top of that, with NAPRO technology, we look at hormonal imbalances and support that as well, because hormonal imbalances go hand in hand with endometriosis. So both of those things, finding someone who's able to do that for you really should drastically improve the possibility that you could conceive naturally and have a healthy pregnancy.
That's really good information. It's just over here it can be really hard to get access to that kind of care on the NHS.
Absolutely.
But we're seeing a sort of rise in people going overseas to have IVF done and things like that. I don't know if it's a bit cheaper or if it's more expertise overseas, but you can get IVF on the NHS here, and I'm sure they know what they're doing, but they're not specialised in endometriosis, the people who are doing it.
Yeah, one thing we see very commonly is women will get a diagnosis of unexplained infertility and they'll go straight to IVF. And sometimes we end up seeing those patients after they fail IVF because they have endometriosis, and endometriosis is going to impact your IVF success as well. So it really is so important, if you have infertility. Unexplained infertility is not a diagnosis. Those individuals need surgery to see if they have endometriosis, because that probably is really what's going on, and it has to be addressed.
So after surgery, are you more fertile? I know you'll be more fertile than before surgery, but in the period of time, not immediately after surgery, but afterwards, have you got a better chance at that point than waiting longer, or is that affected?
Yeah, sometimes we see patients get pregnant almost immediately after surgery. If we have a patient that we're treating for infertility and we're removing their endometriosis, we expect them to get pregnant within 18 months, when we're also doing our hormonal supplementation and, the other support that we can give. But yes, removal of endometriosis drastically improves your fertility rates. And really, we expect that should help you get pregnant without IVF, without IUI.
So that is so interesting. It kind of mirrors my experience, because I had my first specialist surgery in the January of 2009, and then I was pregnant with my daughter by April 2010, and I hadn't been trying to conceive. I did have a miscarriage just before, basically, her. Very, very early miscarriage, but then had her. And then before my operation, I was only 23, 24, so I hadn't been trying to conceive. So I don't know how that would have went. But it's interesting, the time frame, because I was definitely within that time frame. And then when I became out with that time frame, I found it really, really hard again. So that makes a lot of sense.
And sometimes endometriosis does recur. So if we have a patient and we remove their endo and they get pregnant, and they're trying for a second pregnancy and they're not successful in that, we will go back and look again, because it can recur. But to your point earlier, for young women, often they're not trying to conceive, they're earlier in life, and so they go on a hormonal suppression, the birth control pill or something else, not addressed. And so what we talked about before, then you have this progression of endometriosis because we're not actually addressing it. So I think even if you're in a phase where you're not ready to conceive, it's really important to, one, figure out if this really is your diagnosis, and then two, really treat it up front.
Yeah, even if you're not looking to have children immediately, you're still going to want to have it addressed, diagnosed, and removed to save your chances for later on.
Yes.
And how effective is IVF for someone with moderate to severe endometriosis? Is their chances less or similar? How does that differ from somebody without endometriosis?
Yeah, that's a great question. In general, I think people have an overinflated sense of how successful IVF is. Some clinics will quote like maybe 30% success rate per cycle. So their success rates are based on just one individual cycle. A patient might need several cycles to be successful in that. So I think one, we overestimate how successful IVF is. Two, a lot of patients getting IVF, we don't even know if they have endometriosis or not. So we don't quite have data on whether, how much that affects their success rate with IVF. But what we do know is it definitely is less successful if you have endo in place that's not being addressed. So one, if you have it addressed, very, very possibly could just get pregnant on your own without undergoing the financial, physical burden of IVF.
Yes.
But two, even if you did do IVF, you're going to be less successful in that with endo. So it really, really is imperative, even if, you're already down that IVF journey, to take a step back and think, do I still, I need to address whether or not I have silent endometriosis that's affecting this. But really, in the care that I do, we don't do IVF, we don't do IUI, because we're focused on actually treating what's causing infertility instead of trying to bypass that system. So I really wish more women, I think no one should be undergoing IVF without at least a diagnostic laparoscopy to see whether or not they have endometriosis, because that really is what needs to be treated.
Absolutely. And we talked about the silent endometriosis before, which I hadn't heard of. So that was really, really interesting. So are women then finding out during IVF that they have endometriosis and that that's impacting their fertility?
Well, usually they don't. So a lot of IVF doctors don't ever look for endo. They just go to IVF. So what we do is, for any patient who comes to us with infertility, even if they have no other symptoms such as abnormal bleeding or pelvic pain, we still look for endo, because that would be a huge red flag for endo, is just infertility alone. So if you're someone who doesn't think you have endometriosis, but you have infertility, you need to be evaluated for endometriosis.
Excellent. That's excellent advice. And the next thing I was going to ask you about is, so if somebody, say in my situation when I was younger, I did want to start a family not long after my surgery, so that was fine. But say somebody thought, right, do you know what? I've got endo and I've had this surgery, but I don't want kids till I'm 30, for example. Would you recommend freezing eggs at a younger age, or would it be the same outcome regardless?
Yeah, so that is a great question. Kind of in line with what I was saying about IVF, I think people have an overinflated sense of the success rate of not only IVF, but also egg freezing. So I think a lot of people are under the impression that if they freeze their eggs, that guarantees that they will be able to have a baby. And that really is just not the case, because as the eggs are frozen, as they are then, combined with the sperm to create an embryo, and that process, they may or may not actually mature to a point that they can be used in the IVF process. So that's the first thing I'd say, is that I think people have this idea that it's a safety net that's a guarantee, and it's not. So really, I think the better approach, instead of freezing eggs, is addressing the endo. Because if you say that you're 23 and you have your endo removed at that point, your pelvis is going to be so much better once that is removed, that your innate fertility, your fertility that should naturally be there, is going to be so much better. So I really would just say, instead of worrying about freezing eggs, I would really just focus on treating the endometriosis, because that is going to have such a huge improvement on your fertility in your years, or even, into those early 40s. So that, I think, would be a better option and be more worth an individual's time than worrying about the egg freezing.
So I thought it could be like that, because when I had my Malarian check, egg count checked when I was 23, it was completely normal. There was no impact on my ovarian reserve at that point. And then I had it checked again, I think about 3 or 4 years ago. So I would have been about 36 or 37. And it was very low. I can't remember exactly. It was 1 point something. It was extremely low. And I think that was more age, because my endometriosis was just as bad years ago than as it was then. And well, no, it had got worse because I had got the frozen pelvis and the deep infiltrating endo. But back when I was 23, I already had like the bowel involvement, stage 4. So is there a correlation between the quality of the eggs and the endometriosis?
Yeah, I don't know that there's specific data on that, but we really do feel that way as experts in the field. Endometriosis is an inflammatory process. It creates a lot of inflammation in the pelvis, adhesions in the pelvis. And I really think that that affects your egg quality. It makes so much sense. And even beyond egg quality, it does in fact impact your ability to carry a pregnancy after you become pregnant. So we see a higher rate of miscarriage with endometriosis. So I think in general, it is an extremely inflammatory process in the pelvis, and it's going to affect your fertility in many ways. And that's why it really comes down to removing it. When we put people on the pill or hormonal suppression, it suppresses that. So you're typically not having the symptoms as much, but going away, it's still there. And so you come off of that hormonal suppression and you want to get pregnant, and your fertility is not what it could be. So I really think that we are learning more about endo. We need more research on endometriosis,
yes, but absolutely.
It's affecting so much more than we even realize.
Yeah, I mean, I only found out recently, probably within the last year, that it was related to inflammation. And now I'm armed with that information, I'm able to make some choices that change for me. Obviously, I've had the hysterectomy. Between the time of being diagnosed and weighing about 130 pounds, I'm way, way heavier now. And I feel like a lot of that has been related to medications that I've taken for my endometriosis.
Yeah.
Other conditions that I've developed related to my endometriosis, but also inflammation. I absolutely now feel like I have something to work with in terms of weight loss, in terms of it should be better in general because I've had the hysterectomy, but I feel like it gives me something more to work with. And I often feel like this about so many factors with endometriosis is, I was diagnosed 17 years ago. Why did I not know this? Why did I not know that? Why did the doctor not tell me this? And I think you're absolutely correct. It's research. The research is not necessarily happening, or if it is, it's not being widespread enough across doctors or general practitioners, because I am finding so much out at the moment that I'm like, wow, why am I just finding this out now? You've kind of touched on it, but how about hormone therapies, about how they affect fertility in the long term?
Yeah. So a lot of individuals, when they are struggling with fertility, don't get a full hormone workup. And so that's something that I really advocate for. And as part of my practice, we see that women with endometriosis in particular have a lot of hormone abnormalities. So a typical infertility workup may just involve 1 or 2 days where they're looking at your hormones. What we do is a full panel where we look at, based on your cycle, what your estrogen is, what your progesterone is, and we trend that to see if if the levels overall are consistent with what we consider normal. So it is really important to have a full hormone workup to see what else is going on besides maybe endometriosis, maybe PCOS, or some other causes of infertility. Because if we don't look, we won't know and we won't be able to address it.
Excellent, thank you. And that also leads on to, lifestyle changes and diets and supplements that can support fertility in general. What would you recommend to endo patients in terms of that holistic lifestyle?
Absolutely. So based on an individual's specific needs, we recommend certain supplements, but in general, something that I talk to all of my patients about would be lifestyle modifications. We need the surgery, we need the medications to help with pain and fertility, but we also need to approach this from a holistic perspective.
Absolutely.
And diet, movements, what other environmental exposures are we having? So 1 in 6 people at this point struggle with infertility, which is an outrageous number. And we don't
really.
Is that not just insane? It's just out of control.
Absolutely insane.
And that's why so much of this needs to be talked about more. But in that, we don't really have an answer for why that's happening. I personally think it probably is really related in a lot of ways to environmental exposures. And I think that data hopefully will come out. But in the meantime, I think what we can do is take a very cautious approach to really anything we're putting in or on our body. So I mean, the easiest first recommendation I always make is just approaching your diet in terms of looking at whole foods. So turning over the package, turning over the bag, looking at the ingredients, and really trying to stick to whole foods, just buying ingredients at the store instead of what's that?
They just brought, thanks, girls. They just brought me a crepe with strawberries.
Yeah.
We're talking about healthy foods, and I'm sitting eating this.
It's never, it can be overwhelming trying to make lifestyle changes. And so, because of that, I think it's really important to be gentle with yourself, take that slowly. Sometimes people like to approach it like an 80-20 rule where 80% of what they do is on target and 20% is a little more lenient, because we also have to be real.
I like that.
Yeah, infertility patients in general are really stressed out and they're going through a lot. So you don't want to take this so far that you're further stressed out, because that affects your body as well. We want to be realistic. And usually I just one small change after the other, taking it very slowly. It does not need trying to go all in from the start is going to be too much and it's not sustainable. So we do have to be realistic.
That's excellent. I like that 80-20. It's a very realistic, it's very realistic for life in general, I think.
Right.
I love that. So the next thing I was going to speak to you about is I was going to ask, do you have any advice for couples that are facing the emotional toll of infertility? And that's with endometriosis or without.
Yeah, it is such a heartbreaking situation. And that really is why I'm in this field, is because the heartbreak of infertility is so, my heart goes out to those individuals. So something I would say is, sometimes almost even like turning off social media, because I think there's a lot of information that can be overwhelming sometimes, or comparison that makes it difficult. I think finding people who understand what you're going through, and maybe even a counselor, couples counseling. I think sometimes this has a tendency to pull people apart, to pull a couple apart instead of bring them together. And so I think it's really important to try to grow closer to your spouse during that time instead of isolating from one another. I think that's really difficult. So sometimes marriage counseling is really helpful. And in particular, of course, someone who understands infertility. And then, of course, having a physician who really supports you, so you feel like you're being heard and listened to, and hopefully making progress in that journey if you're able to. And then the last thing I would say is often a sense of spirituality is really important to me. So I know that when you have a spiritual grounding that you talk to and you communicate with, it doesn't mean life is going to be easier by any means, but I think it gives you a sense of, and that you're not alone, and that it doesn't make sense. I don't know why this is happening, but diving into spirituality, because it's really an impossible journey. And so that's why I just pray that I can make a difference for people, because that suffering is so deep. If I can relieve that even for one person, that would mean the world to me. So I think those are kind of some things I would talk about with my patients.
That is so lovely. So recently, when my mum credits my surgeon for her having her granddaughter, my daughter Hope, she's an only child and she's an only grandchild. The local hospital was talking about hysterectomies to me at 23 before I went to this surgeon. And he just looked me in the eye and said, absolutely not. We will save at least one of your ovaries. You're going to be fine. And he did. He saved my left ovary and I had my daughter. And what was so lovely was when I went for my pre-op, so at the end of April, I took my daughter with me, who's 14 now, and took her in to show him her.
That's
amazing. I'm sure he has done the same for many, many women and couples in Scotland and out with, but it was just such a lovely thing for him to be able to see. And I think from you saying, if you can help one person, because it's just such a heartbreaking topic, infertility, and it's so hard to talk about, and it really, really breaks my heart. And I just look at my daughter every day and so thankful. Because I know there's women in my position who have now turned 40 and it's not happened for them. And my heart just goes out. It's just so sad. If that's what they want, if that's, a lot of women now choose not to. And then they're still needing their endometriosis treated for pain.
Correct. Yeah. Yeah, I completely agree. As a mother, when I look at my daughter, I am just so overwhelmed with gratitude. And I want to be able to help other people experience the joy that brings. It is the most incredible thing I've ever done. I'm a surgeon. I do all these amazing things and I'm really blessed to do that. But the most incredible thing I've ever done is become a mother. And I'm so grateful for that. And so if I, like I said, if I can help one person, one couple experience parenthood, that would make my whole world. So I agree. I'm really glad there are platforms like this to bring more awareness to this.
Yes, absolutely. And that's what it's all about, is raising awareness. I think with everything surrounding fertility, endometriosis, it's having the conversations so that people can open up, because people can find it quite isolating, as you mentioned earlier. And it's great to know that you're there. So whereabouts is it that you're based?
So currently I am in Omaha. I will be moving shortly and kind of starting a new practice. My goal right now, really, if anyone listening to this would like to follow me on Instagram, I'm under Holistic Fertility MD. My goal right now is just to kind of raise awareness for this type of care, because like you said, it's limited access. So I really want women to know about this and know that they can advocate for themselves, because I am very passionate about this healthcare for women, because this is what women deserve. They deserve better care. Right now, that's kind of my goal, but eventually next year I'm looking to open a practice. And so I don't quite have those details yet, but I'll be moving some.
I can't wait to hear about that. That's very, very exciting. That's excellent. And the final question I've got for you is just to ask about any new research or treatments that are on the horizon for fertility, for endometriosis, for fertility in general, that you might know about.
Well, I think the thing I'm most excited about right now is just more and more awareness of treating the root cause. I think more women are waking up to that this is really what they want. Instead of IVF, instead of the pill, they want real treatment. So I'm just excited that more awareness is being brought to this. More women are hearing about this and getting excited about it, because I think that's really what women want. But outside of that, one thing that has been on the horizon is trying to figure out if we can diagnose endometriosis without surgery. And we're just not quite there yet. There's been some development in options, but nothing that's really been proven to be beneficial. And just to play devil's advocate, I would say most women that we assess and evaluate for endometriosis do have it. And so then we can treat it at the same time if we go back for surgery. So just to play devil's advocate there. But that's something that I'm hoping at some point we would have the ability to potentially diagnose without surgery. I have no idea what
excellent.
But that's been developed.
That would be excellent. I can't remember who I was talking to about this recently. It could have actually been yourself, about then girls and young women could be potentially being screened for having endometriosis. I mean, I don't think that's something that we'll see maybe soon, but it's affecting so many people that the need is there. So they can't give every single 16-year-old a laparoscopy. Of course they can't. But if there's other ways to check, can you imagine? If there's other ways to check, then that would just help earlier diagnosis.
Yeah, because like we talked about silent endometriosis, these women aren't finding out. They've been trying for a year, 2 years, 3 years, 10 years to get pregnant, and then they find out. So you're right. There is that group of women who really don't know until we're far, far into this infertility journey. So yeah, that would be very interesting.
It really, really would. So if you could say one thing to women out there that are struggling with their fertility, that have endometriosis, we've talked about so much and hopefully they've listened to the whole podcast, but if you could say one thing to them, what would it be?
Yeah, I would say you absolutely need to find a physician who is in your corner, who listens to you, who supports you, who wants to actually identify what's going on. We have naprotechnology physicians really all over, some, international even. And so that might be a potential, or just through mouth if you find someone. But unfortunately, it's a system in which you have to advocate for yourself and find a physician you feel like you can work with collaboratively, who listens to you. So it's tough, but it's so worth it. And it has a huge difference in your outcome, truly.
And it's so interesting because everybody that I've spoke to, they have said one of the most important things is advocate for yourself. Just advocate for yourself. And we shouldn't have to spend all that time and energy, because it shouldn't be as hard as it is. But in the current moment, while it is, that's excellent advice. Thank you so much.
Absolutely. Yeah. Thank you so much for having me. I really appreciate it. And I'm sure we'll talk more in the future.
Absolutely. And keep me up to date about your clinic. That's amazing news. Congratulations.
Thank you.
Thank you. Thank you for joining us on this first episode of the MM Endometriosis Podcast. If today's conversation resonated with you, subscribe, share, and hit the notification button to help more people find this space and feel less alone in their endo journey. For more resources, real stories, and upcoming episodes, follow MM Endometriosis on Instagram. Until next time, take care of your body, protect your peace, and remember, you would never know unless you lived it.